Thyroglossal, endocrine disorders of the head and neck. Thyroglossal duct cyst, TGDC. The thyroglossal duct is the narrow tubular structure left from the thyroid's descent and connects the thyroid gland to the foramen cecum. If any portion of the duct persists, secretion from the epithelial lining can result in inflammation and thyroglossal duct cyst formation. Thyroglossal cysts are remnants of the thyroglossal duct. Thyroglossal duct cysts are cystic structures lined by respiratory epithelium, squamous epithelium, or a combination of both. The most common non-odontogenic congenital cervical anomalies, with a 7% population prevalence. Nushrat. Thyroglossal duct cyst, TGDC. Most thyroglossal duct cysts are typically asymptomatic unless infected. However, they can present as an abscess or intermittently draining sinus. Normally resorbed by the 6th week of gestation. The thyroglossal duct cyst is a remnant of the 3rd and 4th pharyngeal arches and tracks along the thyroid gland. The cysts are epithelial remnants of non-obliterated portions of the embryologic thyroglossal duct, extending from the foramen cecum of the tongue to the thyroid gland. Nushrat. 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 They present as a midline neck masses, anywhere from the tongue to the thyroid. The most common location of the cyst is midline, inferior to the hyoid bone and thyrohyoid membrane 75%. They are about 20% to 25% present at the level of suprahyoid, 15% to 20% present at the level of hyoid, and 25% to 65% present at the infrahyoid level. Thyroglossal duct cysts usually are painless, smooth, and cystic in nature that grow slowly. Thyroglossal duct cyst will move upwards when the tongue is protruded and also moves with swallowing. Nushrat. Due to the failure of closure of the thyroglossal duct extending from the foramen cecum in the tongue to the thyroid's location in the neck. Thyroglossal duct cysts are usually seen in childhood with an average age of 6 years and are very rare in adulthood. However, almost 50% of patients present just before 20 years of age and about 5% present in the 5th decade of life. Equal in both sexes. If cysts may get infected, it appear red and tender. Nushrat. The treatment for thyroglossal duct cysts is cervical resection together with the hyoid bone, when involved, is recommended. If the involved hyoid is not removed, recurrence rates of up to 45 to 55% have been reported. The cyst runc operation is considered the standard of surgical management for excision of thyroglossal duct cysts. The cyst runc operation includes excision of the central third of the hyoid bone and a core of base of tongue tissue. Before resection of the cyst, it is important to know that this is not a piece of ectopic thyroid tissue. The cyst can be investigated with US, CT, or MRI. Ultrasound is the ideal initial imaging choice. Cancer has been reported in about 1% of TDCs. Papillary carcinoma is the most common malignancy found in thyroglossal duct cysts, 92.1%, followed by squamous cell carcinoma, 4.3%. Differential diagnosis. Midline neck masses. Cystic neck masses. Cystic metastatic lymph nodes. Dermoid or epidermoid cysts. Bronchial cleft cysts. The importance of TGDC is related to high incidence of infection, recurrence after inadequate surgery, Possible neoplastic change. 1/3 are detected in first year of life, 50% are detected by age 10. They can increase in size after a URI. Nushrat. Thyroglossal duct cyst, TGDC. 831_F1.